The spread of the disease COVID is still apace, and saving lives and slowing down the pandemic has been of utmost importance. With the internet use, all popular information channels and social medias are being bombarded with misinformation, probably stemming out of uncertainty and fear. It is therefore essential that all information pertaining to combat the disease should be evidence-based and accurate, or it may cause harm. For the past several months, there are talks and discussions to see if the use of nutritional strategies will reduce the risks of contracting the virus, and if contracted, to improve the prognosis of the disease, especially through some micronutrients. The most talked about nutrient is vitamin D in treating the disease called COVID-19. Let's see the facts of vitamin D and its role in treating COVID-19. 1. Vitamin D is generally good for bone and dental health in general, as well as body's immune response to the respiratory virus. This vitamin is also needed for proper functioning of our immune system, the first defense mechanism to fight any disease. They have anti-inflammatory and immunoregulatory properties that activate the defense mechanisms. Winter. 2. It is understood that many people living in the northern latitudes like UK, US, Canada and Northern Europe usually have poor vitamin D status, especially during winter, as they are confined indoors for most of the time. Again, once the individual contracts the virus, they will have to isolate themselves and therefore lesser exposure to sunlight, which makes the situation worse. 3. Vitamin D deficiency has also been found among people who are obese, BMI greater than 30, and also among those having hypertension and diabetes. So these people, when infected by the virus, show severe symptoms. 4. Studies have shown that lower levels of vitamin D have a higher susceptibility to disease and infection. 5. The study was made difficult as people who were the victims of the disease were also having comorbidity like chronic diseases and old age, which made the study difficult as they overlapped. Now, vitamin D deficiency may be treated as a comorbid condition that could impact COVID-19 outcomes. Recommendations. 1. There is currently insufficient evidence to determine the benefits of vitamin D in the treatment of COVID-19, although scientists suggest supplementing with vitamin D will protect against respiratory infections, especially among those who are deficient in vitamin D. 2. If you are worried about your vitamin status, do speak with your medical practitioner on the needs of supplementation. 3. Consumption of a nutritionally balanced diet as per the food pyramid, and by including vitamin D-rich foods such as oily fish, fortified food, plenty of green leafy vegetables and fruits may help. Sunlight. 4. Safe sunlight exposure will boost your vitamin D. 5. A balanced diet and lifestyle measures will improve your vitamin D status and also boost your immune system to fight all infection and disease. Fortified cereals. Oily fish. Vitamin D deficiency may occur during winter in the northern hemisphere, and probably due to long term of self-isolation and not receiving sunlight, because it is the main source of vitamin D for most people. Although vitamin D is good for general health, its toxicity can have adverse effects too. Always speak to your family doctor before you put yourself on any supplement.